In the current video, submitted by our fellow Katerina Nouzovska, we are presenting our first case of CAIRS, Corneal Allogenic Intrastromal Ring Segment. This is a very interesting case, very complex case, because it was a patient with an advanced keratoconus pellucid marginal degeneration, only eye, that really the case, whenever you're going to see it, was a case for corneal transplant. But the patient denied any option of corneal transplant because he was very scared, because it was his only eye, and also he already knew that he required a large diameter graft that it perforates and ends up as a PK. There was a high intraoperative risk in the long term, and this patient was relatively young. So he was totally rejecting any option of transplant, but the visual function was highly deteriorated on his only surviving eye, since the only eye was physical. So in this case, I felt that was the ideal case for a CAIRS in order to improve the situation with the minimal risk possible. And as you're going to see, we're going to show you in this video how to perform the surgery, how we did it, how to do it with femtosecond laser. So with femtosecond laser, you can sculpt and customize the thickness, the diameter, and all the parameters of the CAIRS. We're going to show also how to implant them, and we're going to show you what was the outcome, that in this case was very encouraging and very quite amazing result. So I hope you enjoy. I think it's a very didactic video to show how to do this technique. The only thing you need is just any femtosecond laser, and CAIRS, this was our first case, and to the best of our knowledge is the first case of CAIRS done performed in Spain, and I hope you can enjoy it.
Technique CAIRS was described by Dr. Susan Jacob in 2018 as an alternative to synthetic materials in the treatment of patients with keratoconus. Contrary to synthetic segments, they are implanted at a depth of 50%, allowing more pronounced impact on a corneal shape. Thanks to their allogenic nature, we may circumvent certain complications reported with synthetic ones, including extrusion or migration, cornea melting, stromal necrosis, or infection. CAIRS can be prepared manually using a special double-bladed trephine, or the procedure can be assisted by femtosecond laser as demonstrated in our case. A 40-year-old man came for an evaluation of his left eye. He suffered a trauma of his right eye 20 years ago, which resulted in a total loss of vision and oculophthisis. Uncorrected distant visual acuity of his left eye was counting fingers, and the corrected one 0.4. Examination confirmed advanced keratoconus without stria or corneal scarring. Obviously, cornea exhibited high amount of high-order aberration, was 2.79 microns. Due to an insufficient corneal thickness, this case was not suitable for synthetic intracorneal ring segments. That's why femtosecond laser-assisted CAIRS procedure was recommended. These pictures illustrate femtosecond creation of the stromal ring. 2 consecutive lamar dissections were done. First plane was created in a depth of 450 microns with a diameter of 5 mm. The second plane in a depth of 400 microns with a diameter of 6.8 mm. So the inner cut defines the inner wall, and the outer cut with larger diameter defines the outer wall and also the floor of the ring. Finally, the ring of stroma is created. Desired segment of particular clock hours is cut out. Afterwards, we let it out to dehydrate for 1 hour, because thinner and more rigid segment later enables easier insertion. Now let's proceed to surgery itself. At the very beginning, we removed entire epithelium. This is the first cut, the smaller and deeper. Then follows wider and shallower one. A risen stromal ring is then easily separated from the rest of the tissue. Desired segment is measured. In our case, it is 160 degrees. We created 2 same segments, the second one just in case. Creating the tunnel in the recipient cornea with 2 opposite incisions. Tunnel opening. And insertion of our segment. Careful and gradual advancement. Fine pull from the opposite incision. Antibiotics, and the contact lens at the end. Let's see the results achieved in our patient. Actually, they were very favorable. 1 month post-op, patient's uncorrected distant visual acuity improved to 0.6. High order aberration exhibited significant decrease, with corneal comma at 0.58 microns. An anatomical outcome was also very nice. In conclusion, this case indicates that treatment with CAIRS improved visual functions, refractive and topographic parameters. It is minimally invasive, safe, and efficient option. Using femtosecond laser technology demonstrated precision and offers an alternative for corneal graft in advanced cases. Thank you for your attention.